Secure 65 class plans, we're saying it live. Secure 65 health plans, where seniors thrive. Secure 65 health plans, where seniors thrive. Secure 65 health plans, where senior thrive. Secure 65 health plans, where seniors thrive. Secure 65 health plans, where seniors thrive.
Welcome to Talk Power Thursday. This is your host, Moné Swann, your favorite no-nonsense, tell it like it is host of Secure 65 Health Plans, where seniors thrive. And today we are diving deep into the truth behind Medicare. We call this episode Financial Protection and Real Out-of-Pocket Expenses, aka Medicare may leave you stranded. So let's talk about the lifeboats, shall we? Before we get started, you guys, don't forget to call us at 833-300-4968 or email us at info@mybivics.com or click the link in the description box below. Like, subscribe, and share this with all your friends. And let us know in the comments if you love this episode and want more just like it. Now, listen, grab a pen, a piece of paper, and maybe a glass of wine, because if you think Medicare covers everything, well, baby, we need to have a little talk. And don't forget, you can play this video as often as you like. Matter of fact, we want you to do it. I suggest you do it as many times as you need to. Hopefully you won't get tired of my sarcasm. It's all meant to make this topic fun and easy to digest. So, what Medicare does and doesn't cover. Yes, Medicare gives you Part A and Part B, and we love that. Part A means hospital coverage, but don't get too excited. And Part B means medical and doctor visits. But wait, there's a catch. Guess what it doesn't fully cover? It doesn't fully cover you on dental, vision, and hearing. Yep, you can go blind, deaf, and toothless. But standalone policies cover so much more. We even have a couple of carriers that do cover implants. And then there's long-term care. So you need help bathing or feeding yourself? Sorry, Medicare's ghosting you. You need a long-term care policy. Prescription drug gaps? Ever paid $600 for a pill the size of a Tic Tac? Well, thank God there's a $2,000 cap. But that's still $2,000 most of you would like to use on something else. Copays, deductibles, out-of-network care? Because nothing says healthcare like surprise bills that Medicare agent at the call center didn't tell you about. So what do? Well, you plan, you protect, you strategize, not with someone who's just a Medicare agent, but with a financial professional with holistic strategies for your retirement. I'm talking health and money sustainability. There's nothing better than being your own bank in retirement or getting that income you were used to receiving, but now with an annuity. Because you need a money game plan, not just a red, white, and blue card in your wallet. Here are 4 hypothetical cases where you can get paid. So let me introduce you to our 4 examples of what you can receive, whether you're a senior or not. And listen, these policies can be paid for individuals, couples, single parents, and families, and they're very inexpensive. These supplemental plans are the lifeboats, well, most don't know even exists. So let's start with number one, Dorothy, 74-year-old retired teacher, taking care of her granddaughter after her daughter passed. Dorothy was walking her dog when she tripped over a curb and fell. Well, her ER visit had a $400 copay. Luckily, she had an accident plan. She filed a quick, simple claim, and $8,800 was deposited into her account in the next week. She got $400 for going to the emergency room and $400 for an x-ray, $1,600 for hip surgery, and $800 a day for 4 days for being in the hospital, and $3,200 for being admitted. She used $400 of the money to stock up on groceries for her and her granddaughter, and $400 to finally get her car brakes fixed. And the rest of it, the $8,000, was put in savings because she didn't have anything saved because she's been taking care of her granddaughter. Her supplemental policy gave her money to take care of the unexpected and help pay for other needs too. Example number two, Alan, 79 years old, a proud Vietnam vet and grandfather of 6. Alan was diagnosed with cancer. He was admitted to the hospital and received $800 a day for 2 weeks, totaling $11,200. He also received $2,500 for transportation for alternative treatment that was more than 80 miles away from home. Of course, the family had to go with him, and he received another $200 a day for family lodging for 30 days. That's a total of $6,000, you guys. And lastly, another $6,000 for this being his first occurrence of cancer, in which he was paid $200 a day for the 7 days while he was in hospice, in the amount of $1,400. Medicare Advantage covered part of the hospital and medical bills, but his cancer plan deposited a whopping $27,100 into the same account he pays his premiums out of. No lost checks in the mails and no surprises. In this case, Alan decided to take his kids and grandkids to Disney World, flew first class, bought souvenirs for everyone, took pictures, and thanked God that if he could never do anything else for his kids after chemotherapy, they would enjoy this last time together. Example number 3 is Janet, 81 years old, formerly grocery customer service representative, who worked for the same company for 25 years. Janet started feeling dizzy, was rushed to the hospital. She was having a heart attack. She was paid $6,000 because it was her first occurrence. She was also hospitalized for 30 days and received $800 a day. Her family was transported to her town to be with her during this time because they all lived out of town. That paid her an additional $2,500. They stayed with her for the 60 days while she underwent a heart transplant. She was paid a $200 a day for the situation and unfortunately needed a human heart transplant, which she received and was paid $160,000. Medicare paid a portion, but her supplemental policy would have deposited $204,500 into her account due to all of the events she suffered through. The policy afforded her to pay off all of her credit cards, purchase a new car, and a life supplemental policy for every one of her grandkids. And she has multiple grandkids, a huge family. Number 4, Hanson, 67-year-old retired nurse. He's been taking care of patients for 35 years, you guys. Due to Medicare, Hanson's prescriptions were suddenly costing him a lot more money. He was happy that there was a cap of $2,000 now. However, he didn't have $2,000 to pay for his prescriptions. Fortunately, his hospital indemnity plan paid him up to $900 for the year. And you better believe Hanson used that money to pay for his prescriptions. And it also was used to help him find government help and nonprofits. Because between our help, nonprofits, and the government, he was able to pay the $2,000 out of pocket and have money left over to pay for gas, rent, food, and groceries. since his grocery cards has also been cut dramatically through the program. He said, this plan didn't just help me, it helped my whole family. So listen, you guys, this plan works even if you are on Medicaid and you don't pay for your prescriptions. If you purchase the policy that pays up to $900 for the year for prescriptions, you can use that money and get whatever else you want, and maybe even use it to pay for your supplemental policy. I think that's pretty great, because now you have money for rent, gas, mortgage, food, and even transportation, or frankly, anything you like. So if what you are receiving from Medicaid doesn't cut it, this is the way to get it. Each one of them simply submitted a claim, all of the paperwork, of course, and used the money they received for whatever they wanted. No restrictions, no red tape, no begging for permission. If you want that same kind of protection, don't wait. Call us at 833-300-4968 or email info@mybivix.com. Click the link below and start the conversation. Like, comment, subscribe, and let's keep this truth train rolling. Now, accidental plans for those who can't or won't. Now let's talk about the accidental death plan that you need that will pay up to $40,000. Yeah, you heard that right. Can't get life insurance? We've got a policy with free return of premium, so you can use it like an insurance policy. Because if you don't use it, you get all of your money back, all of the premiums that you've paid in after 25 years. No health check, no exam, nothing. Just your money back, less any claims. Most return of premiums on life and critical illness policies are very expensive and, quite frankly, just not worth it. So we have what you need at a price you can afford, free of charge for those ROPs. What about those of you who refuse to pay out the nose for final expense? Try this instead. Fall, trip, emergency ride, stitches, crutches, cha-ching, you're getting paid. I mean, who wouldn't want to get paid for falling at this age or any age? Matter of fact, you're doing it now for free. I'm just saying. And the bills don't stop. This is why everyone needs also a long-term care or hospital indemnity plan. Now, here's the hard truth. If you're taking money out of the market or want home health or think about ever needing long-term care, you need a long-term care or indemnity policy. Medicare doesn't cover long-term stays. It's not about your diagnosis. It's about what you can't do anymore, like bathing, dressing, feeding, toileting, transferring, and continence. You lose two of those things, you're on claim. It's that simple. Don't wait for a crisis. Protect your cash flow now. Have you been to a nursing home lately? Well, they are pretty dismal places, and in some cases, they don't even have the staff to provide assistance to the patients that they have. And so you have to go on a waiting list, and that could be for months. So trust me, you want to have a long-term care policy or a hospital indemnity policy, and don't let anyone tell you that they are expensive. Keep your choices open. Decide now if you want to live at home or a facility, and let us show you how at home is a much better idea. At Bivix, we will find a solution for your situation. That's what we do. We are solution finders, and it costs you nothing to speak with one of our senior advocates or financial professionals. Now let's get real about supplemental coverage. Medicare Advantage, Medigap, traditional A and B, Medicaid, and your pension. They're all needed, but let's be clear. You need supplemental policies. Cancer, heart, stroke. Because nobody ever plans to get sick or hurt. But these are the unexpected things that happen. Accident plans. Because life doesn't care about your calendar. And accidents happen whether you're at fault or not. Hospital plans. Because those copays and deductibles, they don't pay themselves, you guys. These plans pay you directly, right into your checking account. No permission needed. Spend it on alternative treatment, doctor visits out of network, premiums, on Medigap or for the 20% of whatever you have to pay from your original Medicare. Heck, we even have a hospital plan that pays you for your prescriptions, whether you pay out of pocket for it or not. So let me say that again for the people in the back. You can use this money for whatever you want. What about dental, vision, and hearing? Oh, don't get me started. Those little extras on Medicare Advantage plan? Well, might as well be coupons from 1996. The answer? Stand-alone dental plans. Real benefits, real coverage, real peace of mind. Okay, you guys, so let's wrap up real talk with some real life. Seniors, let's get real. Accidents happen. Illness happens. Medicare does not cover everything. You need financial protection, strategic policies, cash flow options, and you need them before things go sideways. You're going to go to the doctor anyway. You're going to fall probably. You might as well get paid for it. That's how I look at it. This has been your weekly dose of real talk on Talk Power Thursday. Don't wait to protect yourself until you're sitting in a hospital gown with no coverage and a $3,000 bill. We have several carriers that we work with, and we have an ICU policy for as little as $4 a month. So what are you waiting on? Call us at 833-300-4968 or email us at info@mybivix.com and click the link in the description box to get started today. Don't forget to share, subscribe, and let us know what you want to hear next. I gotta say this. It's the elephant in the room. We're not chasing commissions. We're here to serve. While others see you as a dollar sign, we see you as part of our mission. We meet you where you are to talk holistic living. So don't get taken, don't get bamboozled, don't get scammed. We can talk on the phone, meet on Zoom, meet in your home or your assisted care facility or community center or wherever you want. You have a POA, power of attorney? We will meet with both of you. We don't believe any senior should enroll in Medicare with a stranger or for any other type of insurance or financial vehicle. You will have your personal senior advocate or financial professional and his or her cell phone. No 800 numbers, no leaving messages after 5, and no, not available on weekends. We don't do that. We are here for you whenever you call. Matter of fact, we will start our Love and Trust Tour in August. So if you want to meet us or you want us to meet you, tell us where you are, your senior center, your assisted care facility, your community center. Email us and call us and come join the fun. We do educational and seminars on holistic products like life, annuities, supplemental, and long-term care. Okay, you guys, we're on to the next day. Okay, well, that's it for this segment. So, you guys, we are on every day. So watch us and join us for Make Money Count Monday. It's all about your money, Social Security, retirement, and Medicare and Medicaid cuts. We also cover life insurance, annuities, RMDs, and how to keep your money and turn it into income during your senior years. So don't miss out and bring all of your questions. Then we have Tech Tuesday. So you can tell your doctors what you want, why you want it, how it works, and ask how long is it going to take for him to get it to you. He will have all new respect for you. Then we walk into Wellness Wednesday. This is where we talk about diet, exercise, and your overall well-being, mentally, physically, and spiritually. Next, Talk Power Thursday. Sarcasm, comedy, truth, and solutions. Just the facts. And next we have Feel Good Friday, because we all need a boost after a long week of nonsense. And that's going to walk you right into Share the Wealth Saturday, where you can find charities where you can give money, receive money, and build a community with those you love. We close out the week with Serenity Sunday, where meditation, peace, love, and a fresh start are the order for the day. And seniors, please listen to me. Stop watching all that stress-filled news. Just because your parents did it doesn't mean you should. These are times that we need to protect our peace. Look for solutions, not problems. Matter of fact, you don't have to look for problems. They will find you. So guard your peace like it's a rare coin. Also, stop calling all these call centers where agents try to tell you what you need in 5 minutes. Give us a call, interview us, and let's see if we are a good fit for each other. We are financial professionals who can give you a holistic plan that takes care of your health, your wealth, your sanity, and your life. We are Vivix Wealth and Insurance Solutions. We are truly here for you. So shut down the noise, the chaos, the fraud, and call us today. The link to our information is in the description box below. Thank you for being here with us on Talk Power Thursday. Come on back tomorrow for Feel Good Friday, because who doesn't want to start the weekend on a good note? I'm Moné Swann. Stay happy, stay healthy, stay wealthy, and always, and I mean always, stay golden. Love you guys. Bye.
Vivix Wealth Insurance Solutions.
Secure 65 class planes, or saying you fly. Secure 65 health plans where seniors thrive. Secure 65 health plans where seniors thrive. Secure 65 health plans where senior thrive. Secure 65 health plans where seniors 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 thrive.
Collaborative Expansion Foundation, bringing people to truth through love and knowledge. We are a nonprofit organization. At Collaborative Expansion Foundation, we empower seniors by addressing their critical needs and fostering trusted relationships. We combat loneliness, financial insecurity, and access issues through education, community engagement, and support. Guided by our motto, no senior should enroll in Medicare with a stranger, we strive to ensure all seniors receive the care they deserve. Together, we create a caring, inclusive community.